Can medications affect blood lipid testing results? Have you ever wondered how your medications might impact your blood lipid test results? It's a question worth asking, especially if you are monitoring your cholesterol and triglyceride levels. Understanding this can help you and your healthcare provider make informed decisions about your health. Blood lipid testing typically measures total cholesterol, low-density lipoprotein cholesterol, high-density lipoprotein cholesterol, and triglycerides. These components are essential for assessing your risk for heart disease and managing conditions like hyperlipidemia. Many medications can influence these lipid levels, leading to variations in test results. For instance, certain diuretics, particularly thiazide diuretics, can raise triglycerides and low-density lipoprotein cholesterol, especially when taken in higher doses. Older beta blockers may also slightly increase triglycerides while lowering high-density lipoprotein cholesterol. If you are taking medications like protease inhibitors for HIV treatment, be aware that they can significantly elevate triglycerides and low-density lipoprotein cholesterol. Some antipsychotic medications and retinoids, such as isotretinoin, are known to raise triglyceride levels as well. Even some oral contraceptives can increase total cholesterol and triglycerides, depending on their composition. On the flip side, certain medications can have a positive effect on lipid levels. Alpha blockers, estrogens, hormone replacement therapy, and selective estrogen receptor modulators can lower low-density lipoprotein cholesterol or raise high-density lipoprotein cholesterol. Newer beta blockers tend to have a neutral or less adverse effect on lipid profiles, which is good news for those concerned about their cholesterol levels. When interpreting blood lipid test results, it is crucial to consider the medications a patient is currently taking. A rise in triglycerides or low-density lipoprotein cholesterol might be due to medication rather than an underlying health issue. For managing hyperlipidemia, healthcare providers may consider switching to a medication that has less impact on lipid levels if possible. If the medication causing the changes is necessary, regular monitoring of lipid levels becomes essential. Lifestyle changes, such as adopting a healthier diet and increasing physical activity, remain as important in managing lipid levels, particularly when medications are influencing test results. In cases where medications cause significant elevations in lipid levels, a reassessment of the treatment plan may be necessary, including the possibility of adding lipid-lowering therapies. In summary, medications can indeed affect blood lipid testing results by raising or lowering cholesterol and triglyceride levels. Being aware of these effects is vital for accurate diagnosis and effective management of hyperlipidemia and cardiovascular health.